Development matters, development matters. If for you, if for me, development matters, development matters. Gotta try to make a change. We need roads, food security. Liberia needs electricity. We need national unity for me and you in every community.
Alright, I want to say welcome to this focused discussion. Once more, my name is Gbarpolu County. I want to say thank you to all of you for taking up your busy time to form part of this important healthcare financing community media for Gbarpolu County. So what we are about to do is what we call focus group. We want to look at some of those things that we think we did not talk about, and we think that you have some answer for us. So basically, I want to get to know from you, and if all of you who are here, if all of you who are attending this particular program, is it true?
Yes. Yes.
Okay. So if all of you who are attending this, why did you attend this group? I want to get something each. Why did you attend this program?
I was told some previous days ago that we're going to meet on the day to discuss development issues, specifically when it comes to the health sector. And I think being a child of the soil will be a good thing to discuss issues of health pertaining to the people of Gbarpolu County. So I think the nation will come and discuss the health sector.
Okay. Let me also hear from you why you decided to attend this meeting. You got to call your name, then you answer.
Okay, just speaking, I'm Shema.
No, you already.
Okay, I'm Lady of Ibala. Ready for this program. I was not really aware, but I got to know lately. And it was good for me to be part of this forum. I was in Monrovia. I have to pay my way last night to come here.
Okay. Let me hear from you, my brother, why you decided to attend this forum today.
First of all, my name is Mr. Yakuna Kezo. I decided to be part of the program because it's more educative. We heard those things about the health system. I mean, we're not surprised. But the one good thing that I really got from here, from what we discussed, is the little fee that we'll be paying for our own health. It's very, very important. For the previous, for our previous speaker, more especially Mr. Jusupana, who is the focal person, charge of our focal person, he may mention that in time past, people were paying little fee, and they have women who were directing how the fees were going, and it was a good thing that we heard about it. So that same thing can come back, because.
All right, let me hear from my sister there, Inte. So why you decided to come to this community media forum today?
Speaking to you, my new couple man. The one where made the program, I can't the program. The one where I can't hear you before. I hear you today that they say, man, be doing free thing. Because when you do free thing, you can't get important for you. So when you be doing anything, you post something on it, you can get reporting on it. So it made me happy.
Let me hear from you.
Yeah, okay, I'm James Smith. On an initial point, I did not know about this meeting, but I was invited personally, and it was good I came. It was rewarding because I got some insight that more especially when it comes to health, and which I think is a message for me to take it. And it's very, very brilliant that I came.
Okay, my sister, why you decided to attend this program today?
My name is Mama Anton. I attended the program through my chairman, Rupert Clark. He's the chairman of the Gbarpolu Youth Accountability Forum. He's the one who called me here. And I came here, I learned something from the program.
Okay. Is that Clark?
All right, thank you very much, Mr. Boloma. Just want to be grateful to God for allowing me to be part of this program, because being part of this program today, at least I was able to know that really my people health, our people health is my concern. That's why I prioritize most in my life. Healthy life. It's my major priorities. That's the reason for which when you talk about this whole program, I deem it necessary to steam myself and every other activities to be able to come and be part and parcel of this program. That's why I'm here.
Let me come to you on this stuff. This program that was on the radio, will you listen to it when it is being broadcasted another time? And why will you listen to it? Why?
First of all, my name is Farina Iwala. I would like to listen to it because what I learned here today, I'm carrying the news to my community. At least next time, if people happy to play it, other person put their radio on and hear, they say, oh yes, indeed, what this girl King she told us, it is true.
Okay. Brother, will you listen to this program another time whenever they play on the radio? If yes, why?
Yes, my name is Gbarpolu. The issue today has made me to get knowledge that even when I came here, when some of the people in our community, they will know the impact of what you people are teaching us today. Because healthcare is the best thing in life. Because if you are well, you are being able to do any other work for yourself. But if you are not well, you are not able to do any other thing by yourself. So I'm very happy to be able to attend the important meeting.
Okay. Let me move to my brother. The next time when this program is played on the radio, will you listen to it?
I think it will be a good thing always to listen to it.
Why?
Because a lot of information, the more you listen, the more you are reminded, you're going to have some more.
Okay. But sister, do you feel that the panelists, they didn't let anything out that they didn't talk about today?
Very, it's like they touch all, nearly all. Because everything pertaining to health, it was discussed. And even the difficulties in the hospital, what we are facing in the county, we see, or even the women president spoke on it, and what the CHT said. I think he said one thing that it didn't go down well with us. That the nurses, the way the nurses can talk to patients. Nurses are counselors for patients. You don't talk to the patient. The way you talk to the patient, it will make them to get well, and it will also make the senior to get worse. So what he said there, it was very bad. I think there we conclude on most of the activities in the hospital.
All right, let me move to so what were some of the 3 main issues our panelists talk about?
The first one, first one is the health. I think that was a cardinal issue that they already mentioned. You know, a health for everyone is a very good thing.
Okay.
Yes.
Talk about 3, the main one.
Yeah, but they left out something. All of the panelists left out something.
Okay.
I think Mr. Pana mentioned about, how they call the administrator, Mr. Benny. He mentioned about sending drugs to all the facilities around the county. And they didn't talk about the terrain. I think they feel that I heard that they hired some motorcyclists to take drugs to Bele. You see, though difficulty that they are going through, we're getting to know about some of them, but they did not mention about those things. And those things can hammer the delivery of healthcare system within the county.
Okay. Let me move to my sister here. Yeah, okay, let me go this way. I want to know here, what are some of the 3 key things that people talk about today? Yeah, somebody want to talk about that.
Yeah, one of the key things that we talk about again was how the distribution of the drugs is left. Because some of the things within the health sector, after all our citizens, we don't know much. But today, if they can check some of the things, how the drugs distribution was left, they get to know the inside of the hospital now, that if they are fraud coming through, then we the citizen of Gbarpolu will get to know.
Alright, let me move to my sister. So I want to hear from you. You know, is there anything that you think after this community meeting, is there anything that you would do differently from what they will discuss today?
Anything I would do differently, positively or negatively?
Yeah, in that negative or positive, when it comes to the healthcare finance.
Well, what I'm going to do now is on the positive side.
Because of this forum, you listen to
Because of this forum, what I learned, if I happen to go to the hospital or take my child to the hospital, if the doctor happen to give me a prescription, Whenever I get to the drugstore, when I buy any pills, I will always like to check on it to see whether this drugs is updated or not. Because when the drugs is updated and I'm giving it to my child, it will also increase the illness. They say, oh, the people never prescribe the record medicine for my child. I'm giving the medicine to my child, instead of my child getting well, but the illness just increasing.
Okay. Mr. Clark?
Yes.
Will there be anything that you do different now that you listen to the phone today? You listen to what you say?
Yeah, I listen to all. For me, one thing I would be able to do positively, I can assure my people and our people that as of this date, whenever I'm carrying on awareness, I will include this information in my awareness. Whenever I go to the market ground where you get marketeers assemble there to do their business transaction, I make sure I tell them the importance of paying this amount and so that the law can be enforced, at least to take steps. Because one thing I will make them to understand is that if we were not in Gbarpolu, definitely the clinic couldn't be built. Definitely the hospital will not be built. It is because we are here. That's the reason why the hospital is built. So I'm going to sensitize them and have them informed with this information that make use of it. Make it your own business, put it in your shoe, and only for yourself, and only that is go and pay that little amount that the people are telling you to pay and be able to get the real treatment.
Okay, for my sister, I want to know from you, what way did you learn about the topic discussed today, healthcare financing? How can you explain to somebody healthcare financing?
Actually, I got to know that all affairs, the government, the hospital will just rely on the government. But I got to know that the government paying some part and the citizens are paying some. And the citizens even paying more than the government. I got to know that. And I will testify, oh, maybe they will say, I'm going to the hospital, I will not pay money. I will not, when they put me, I will pay money, I will not pay money because the government paying. I will say, no, you should pay your money. Because if you pay your money, they will send for good jobs and you will get good medicine so you can be healthy.
Okay, let me go to Mr. Smith. Mr. Smith, in your own way, how can you explain or what did you learn about the topic we discussed today, healthcare financing?
Yeah, our healthcare financing, I think, is very important because today, majority of us got to know that we are being dependent on the NGOs and not knowing we ourselves we have been spending more money. So why not the money that we are paying from our pocket, which is something like 42% of the overall, why not we pay it to the various facilities that will be enabling the facility to produce or provide rescued drugs for our people, because most of our people, when they are given the prescriptions, they may mistreat themselves because they may not buy the right for drugs and they may not know the potency of that drugs and it may cause harm instead of help. Okay. So it is important, it's very important that we support our meager way that will be able to provide the necessary health provision for ourselves.
Okay, let me come to Liberia. Apart from the topic today, what other topic do you think should have been good for this discussion too? Apart from the healthcare financing.
Well, the problem is that we need to discuss the healthcare financing. I don't think other topic, because we shall continue with financing, healthcare financing, so we can be educated more and educate our people. Because we cannot jump from there and go into another topic. Because immediately that the topic we need to discuss, at least so our people can be aware, awareness can go on in the various districts, in the various communities, to let our people know this is what is going to happen, or this is what is happening now at the various health facilities.
Okay, let me just hear from Mr. So, what topic do you think we should have talked about here today?
We should have talked about, as I said, the road connection within the county. That should have been cutting off to our discussion, because if you compare nurses who are in Kongba, you compare nurses who are in Bele, you compare nurses who are in Gomolala with them of Bobolu, I think Bobolu nurses are much better. So our lawmakers should see reason and so they can establish. I will just learn today that